Hello and welcome everybody to our Zoom education session on understanding denial and lack of insight in dementia. I really want to thank you for joining us for this important discussion. My name is Chris Van Leuven and I'm an education coordinator here at the Alzheimer's Society of Peterborough, Kawartha Lakes, Northumberland, and Haliburton. And joining me today is another member of our education team, Shelby Berry, who's collaborating with me to bring you this presentation. So Shelby and I recognize that throughout our discussion today, there might be several questions that do come up. And just in the interest of time, and because I'm not always able to see the chat box while I'm sharing my PowerPoint screen, we'd ask you to hold your questions until the end of the presentation. Please feel free to, jot down a question as they come up or post it in the chat box. So that we don't forget to check it at the end and we don't forget to answer it at the end. And I want to thank you in advance for your help with this. Let's take a little look at the topics that we're going to be covering today. So first, we're going to explore what is denial. Then we'll define these two terms, anosognosia and confabulation. We'll look at some of the challenges that come up when we're supporting somebody who's experiencing anosognosia. We'll talk about reasons that family members or care partners of a person living with dementia might deny that diagnosis or the changes that are occurring. And lastly, we'll talk about ways that we can be helpful in supporting family members who are experiencing this denial as well. Let's get started by looking at the term denial, its definition, and what it means in the context of dementia. So the dictionary definition of denial is that refusal to admit the truth or reality. And in psychology, it's defined as a mechanism in which confrontation with a personal problem or with reality is avoided by denying the existence of that problem or reality. And to be in denial means refusing to admit the reality or truth of something unpleasant, as in a person in denial about his health problems. And it's really common for those that are newly diagnosed with dementia to experience feelings of disbelief and feelings of denial. And it's normal to express thoughts like, oh, this can't be happening to me, and it can't be as bad as the doctors say. In the beginning, denial can be a really positive force because we use denial to shield ourselves from news that's too painful to bear at that time. And we use that denial to help us as we adjust inwardly to our new reality. However, living in denial, staying in that denial is not going to help you to live well with dementia. Someone who is newly diagnosed with dementia might have difficulty accepting their new reality. Denial is a coping mechanism which can help us deal with the grief and feelings of loss that might come with a diagnosis of dementia. Another reason that a person might deny their diagnosis is that they haven't really noticed their symptoms or that their symptoms are getting worse. The person might be unaware of the more subtle changes in their abilities. In fact, the early symptoms of dementia might be more apparent to those people that are closest to the person than they are to the person themselves. Furthermore, difficulties with memory and the retention of new information related to dementia might have caused the person to kind of forget their diagnosis or not remember the conversations they've had with their doctor. It's also possible that the person might try to rationalize the symptoms that they're experiencing as completely normal. In the early stages of dementia, those changes in memory, for example, can often be brushed off as a normal part of aging. And lastly, the stigma associated with dementia might make the person hesitant to accept their diagnosis. Unfortunately, there's still a deep lack of understanding that exists when it comes to dementia. And there's many widely accepted myths about what it means to have dementia. And people living with dementia often experience discrimination simply on a basis of having that disease. Out of fear of the types of reactions that they might receive from their friends or from family, the person might be reluctant to talk about the changes that they're experiencing, and they may delay sharing with others that they have dementia. And from an outsider's perspective, this withholding of information or keeping the diagnosis a secret, or the person's refusal to admit that they're living with dementia, might look like denial. Now that we've had a chance to define denial and explain some of the common reasons for denial when it comes to dementia, we're going to define and explore the concept of anosognosia, which is another way to understand the lack of insight that might be apparent in dementia. So I'll pass things over to Shelby now to get us started.
Great, thanks, Chris. So yes, as Chris said, we've gone over denial and we have a better understanding of that and why it may happen. So we're going to explore these concepts of anosognosia and its impact on awareness and insight in dementia. And then Chris afterwards will take some time to further define the concept of confabulation as well. So let's get started with anosognosia. So anosognosia is a bit of a mouthful to say, but it is a term that's actually completely translatable. So let's break it down to better understand what this term means. So the A in anosognosia means no or not having any. The gnosis means illness, and the gnosia means knowledge. So directly translated, anosognosia means no knowledge of illness. So a person with anosognosia has no knowledge of their illness, and we commonly refer to this in more kind of plain terms as they have a loss of awareness or insight into their own illness. So the person with dementia, sometimes we say they don't know that they don't know, or they often forget that they forget. You may have heard those phrases used before as well. So anosognosia differs from denial. So as Chris mentioned earlier, denial can be seen as a coping strategy. People often use denial to perhaps ignore, avoid, or reject something because it is too difficult or it causes too much stress for that person. The person may minimize a problem or accept maybe only part of the truth. So for example, the person may accept the fact that they are chronically ill, but they may avoid dealing with it by choosing not to take their medications. Anosognosia, on the other hand, is a condition that results from physical changes and damage in the brain. And this typically happens in the prefrontal lobe, so the front and top part of the brain, and in the parietal lobe, so the area of the brain above our ear on the right side of the brain. So in short, the difference between anosognosia and denial is that anosognosia is caused by physical damage or physical changes to the brain. So it's therefore anatomical and physical in origin. Denial, on the other hand, is more psychological in origin. So oftentimes, we may hear care partners or family members say that the person with dementia is in denial, or they're not accepting their diagnosis or the changes that are happening with them, when in fact the lack of awareness or insight may be related to anosognosia and may not necessarily be denial, as the person once thought. So anosognosia is common in dementia, especially as the person moves into the middle and late stages of the disease. So it is a direct result of the physical changes or damage to the part of the brain that affects perception of one's own illness. So this means that, no matter how much, we reason with the person or we argue with the person, maybe about the diagnosis or the changes, they often cannot appreciate or understand their condition. And on top of this, it's not their fault, and they're not doing this intentionally. Their brain has changed such that they are physically often incapable of insight into their illness. So essentially, anosognosia, or this lack of insight and awareness into one's illness, is a symptom of dementia as a result of the changes happening in the brain, just like memory is a symptom of dementia because of the physical changes that are happening in the brain. It's also really important to recognize, we say this quite often, that every person with dementia is unique. So this is also the case when it comes to the concept and symptom of anosognosia. So some people are aware of the changes in their functioning when they have a diagnosis of a dementia, and they may even be able to tell you, I have Alzheimer's disease and this is what I'm experiencing. This is more common in the early stages. In the early stages, there may be problems with short-term memory. So that's the memory of something that happened, say, 5 minutes ago, or what you had for dinner last night. There may be changes with decision-making and judgment as well. However, things like language skills, like speaking, visual, spatial skills, like knowing where your body is in space, and math skills, for example, may remain until later on in the disease process. So as dementia progresses, anosognosia, or this lack of awareness into one's illness, may progress as well. So the person who used to have some awareness of the changes in their abilities may lose that awareness over time. So they may have a hard time accepting help, for example, as a result of this lack of awareness. And they may say things like, I've been sharing myself my whole life, I don't need your help. So again, they may start to lose insights, for example, into their abilities related to their personal care, and not understand that, the time has come where they may need some help with that.
So you can see on the screen there an illustration of the range in self-awareness that can occur with anosognosia. The person with dementia might be slightly aware of their dementia and changes in abilities. They might be completely unaware, or somewhere in the middle. And this can fluctuate day by day or even from one moment to the next. And this is totally normal. Over time, the person may lose more of their self-awareness as their brain continues to change. All right, so we're going to switch gears a little bit from anosognosia and talk about confabulation. So perhaps the person with dementia in your life has started to make up answers to your questions that you know to be false. Is the person lying? The short answer here is no. It's not lying, it's a confabulation. The purpose of a confabulation is not to mislead, and it's not to lie. Confabulation is making up an answer or responding with remarks that link pieces of information or pieces when it comes to things like time or places and people that don't really belong together. For example, if you ask the person with dementia what they did today, they might respond with, I went to work, when you know that that person retired 10 years ago. And it's not that the person is lying. They may truly believe that they are younger than they are and that they went to work that day. And in these situations, it's not really helpful to correct the person or to try to reorient them to our reality. Instead, we're going to use validation. So you might say something like, oh, how was that? Or must have been a busy day. And you'll find that this approach creates less conflict and it allows more opportunities for the person to reminisce a little bit about their work life. When supporting a person who's living with dementia that's also experiencing anosognosia, it can lead to some challenges for care partners. And over the next slides, we're going to explore some of those specific challenges, and then we'll provide some suggestions for care approaches that might help. So that lack of awareness might lead to some challenges for care partners, and you can see we have them listed up here on the screen. The first one is refusal of medical assessment. So the person with dementia might not notice some of the physical or cognitive issues that require medical assessment or intervention. So they might refuse to go see the doctor. They might refuse to go to the clinic. They also might refuse to take medications or participate in, therapies like physiotherapy or occupational therapy because they think that they don't need it. And the person's not intentionally trying to be difficult here. Their brain is telling them that they're fine, so they believe it, just as we believe the information that our brains are giving to us. Number two, they might become angry when deficits are pointed out. So if the person's unable to appreciate their diagnosis, they may react poorly when we point out some of the deficits that we're noticing. No one likes to be told that, they can't do something, especially when they believe that they're capable. Number three is safety risks. And some of the common safety risks are what we call the 4 Fs. So that includes fire, falls, frailty, and firearms. So, if somebody has anosognosia and they don't have the ability to recognize that maybe their skills have changed or their abilities have changed. When it comes to cooking, for example, they may, try to prepare a meal and they could be at risk for starting a fire in the kitchen. Or for somebody that, was an avid hunter, have used guns for many, many years, they may still believe that they have the skill set to use that firearm safely, when in fact, those skills have been lost or they've changed over time due to their dementia. So that puts them at a greater risk when it comes to accessing firearms. Number 4 is kind of lumped together here: poor personal hygiene and resisting care. So a person living with dementia might begin to exhibit poor personal hygiene, such as, not brushing their teeth, wearing the same clothes every day, or not bathing. And, if you were to approach them and ask them if they'd like some help with these personal care tasks, the person might become angry. Confabulations might arise. So they might say something like, I don't know what the big deal is. I just showered yesterday, when you know that the person hasn't bathed in quite some time. And again, the person isn't lying. Their brain is telling them that they had a shower yesterday. So they're just relaying that information that their brain is giving them. And lastly, here on this list, they might be unaware of how their behavior or what they're saying affects others. So because of that lack of awareness or insight, the person with dementia might not recognize when they say something or do something that's hurtful or not socially acceptable. They may, hurt our feelings and have really no concept that they've done that. So what can we do when we experience these challenges? On this slide, we've listed 5 care approaches that can help. So using a positive approach to communication, providing a structured routine, downsizing responsibilities, working together, and staying calm and focused. And we're going to go into these in a little more in-depth way over the following slides. So what is a positive approach to communication? What do we mean by that? Well, first, we mean coming into a conversation with patience and kindness. We really have to set our own mindset as we approach the person to have this type of conversation. We want to validate the person with dementia's reality. We don't want to dismiss it, or we don't want to try to correct it. And we're going to talk a little bit more about validation next. And we also want to remember to focus on the person's strengths, what it is they can do instead of their deficits, what they can no longer do. Validation is really an important part of positive communication. So when a person has memory loss and loss of insight and awareness due to the changes in the brain caused by dementia, it's important to recognize that the person might experience a reality that's different than our own, or different than our here and now reality. Validation requires that we step into that person's reality to see the situation from their perspective, even though it might not correspond with how we're seeing the situation. It's helpful to validate how the person is feeling at that moment in time, and to respond in a respectful way and a supportive way to their emotions, rather than correcting the facts of what it is that they're saying. It's important not to dismiss, minimize, or ignore the person's perspective, feelings, or experience. Their perspective of the situation, combined with the emotions that they're feeling, are very real to them. They may also be responding in a particular way because there is an important need that's maybe not being met. When we use validation as a communication strategy, we're able to enhance rapport with the person, including trust, and have safety in the conversation. And we also provide an opportunity for the person to be successful in that communication as well. So how can we use positive communication in our approaches to care? Well, there's a couple examples here on the screen. So let's talk a little bit about providing that structured routine. Having a routine can be really beneficial for all of us, including people living with dementia. So you might find it helpful to set certain days as bath days, as social days, as outing days, or appointment days. You might choose to have meals at specific times each day as well. And these routines provide a sense of familiarity and comfort to the person living with dementia. So a positive approach, if we're introducing a routine, is to kind of, make sure that we're communicating the steps of our day to the person living with dementia. So on the screen, you can see the example. After we walk the dog, we'll finish the laundry and then sit down for the lunch that I made. So just making sure that we're cueing the person to this is how the day is going to roll out. Next, we have downsizing responsibilities. Sometimes we can expect too much from the person living with dementia. So we want to be honest with ourselves about, what household activities, what responsibilities the person is still able to manage, and maybe to offer to assist or take over the tasks that have become too challenging. You may even want to consider downsizing your own responsibilities by seeking assistance from family, friends, neighbors, or even agencies with things like meal prep, house cleaning, yard work, or even transportation, getting to and from appointments. And if you were going to approach that topic in a conversation, you might say something like, it's time to plan ahead about having someone to do the yard work so that you have more time to do what it is you'd like to do. Next, let's talk about working together. And this means working together with the person who's living with dementia and with the other members of the care team. So that's people like other family members. That includes, medical professionals like doctors, also, healthcare professionals like PSWs. And just remember that you don't have to do it on your own. And here on the screen, you can see that positive approach when we talk about communication. The example is, to keep up with these bills, we should work as a team. I'll come over on Saturday with coffee and we can write out the checks together. So, teaming up for some of these tasks that have become a little bit more challenging. And lastly, staying calm and focused. So if you find that yourself or the person living with dementia is starting to get, maybe a little worked up or maybe a little agitated, it's time to take a breath and suggest taking a break. So maybe, making a cup of tea or going outside for a walk. Those tend to be kind of easy options. When you go into a conversation, consider sticking to just one topic or one question at a time, because if we switch topics too often or list too many steps or ask too many questions, that can cause confusion or frustration for the person living with dementia. We want to keep it simple and just stick to one thing at a time. So if you'll recall, a person who's experiencing anosognosia can have different levels of self-awareness. If you think of that screen, that image on the screen of the arrow and the progression there. So the person can range from aware to slightly aware to completely unaware. And you might take a different care approach depending on the person's level of insight and awareness. So for the person who's aware, their reaction might be sad or tearful. And our solution as a care partner is to offer help or assistance as needed and to provide reassurance to help to decrease the person's anxiety. For the person who is slightly aware, their reaction could be paranoid. And our solution here is to offer both reassurance and some help if it's needed. And for the person who's completely unaware, their reaction may be anger. First and foremost, we need to make sure that everyone involved is safe. So this may mean, giving the person space by removing them from a situation, for example, like a busy shopping mall, or it might mean removing yourself as the care partner from the situation to give them some time to cool down. And you might say something like, I can see that this is really frustrating. And in that case, you're validating the person's emotion. And then you can follow it up with, I'm going to go make a cup of tea and maybe we can find a better solution when I get back. Those are some just different approaches to care depending on the situation. I'm going to hand things back to Shelby now, and she's going to take a look at how denial may present in the people and family members of those living with dementia.
Thanks, Chris. So yes, another topic we're going to discuss today is denial in family members. So sometimes we may often have someone come to an education course and they say, I'm not sure what to do about my brother, like his head's completely in the sand about mom's changes and what's going on with mom. So we hear that often, and certainly acknowledge that this can be something that families are dealing with. So we're going to take a moment to look at the possible reasons why a family member may deny that a person close to them has dementia, and we'll also look at some ways that we could help that family member. So there are many reasons why a family member may deny that someone close to them has dementia or showing signs of dementia. So let's take a look at some of these reasons. So they might hope that it'll go away and that the person will get better. So kind of like, oh, if I don't address it, maybe it will just kind of go away on its own and take care of itself. But unfortunately, we know that dementia is a progressive and degenerative disease that does not get better with time. So, those changes will continue with time. And, at some point, those changes will become quite evident. Families might deny that a person has dementia if they rely on that person. So, whether that's physically, emotionally, socially, or even financially, if the person, is being diagnosed at a younger age. So by acknowledging that the dementia is real, family members may have to come to terms with an inevitable shifting of roles and responsibilities. So, maybe that person was doing the grocery shopping or the laundry, or was the primary driver in the household, or help with the meals or manage the finances. So often when there's a diagnosis of dementia, at some point there's some shifting in roles within the family. Sometimes we see that family members who don't visit the person with dementia regularly may not see the changes that other family members are seeing. So they don't see those subtle changes in the person over time that other family members may be seeing, who perhaps live closer or spend a more extended period of time with the person. So the person who doesn't visit regularly or for too long may deny any changes because the person appears well when they do visit. So whether this is someone that lives locally and just doesn't visit for a long enough period to see those changes, because many people living with dementia can present very well, in those short periods of time. Or we might see if someone's supporting a family member from a long distance, and maybe they're only having those conversations on the phone, they might not notice some of those changes that family members who are more directly involved are noticing. Another reason a family might be in denial about a dementia diagnosis is fear about the future. So, we talked about earlier about dementia being kind of a coping mechanism, and that can certainly be the case for family as well. So again, acknowledging that the dementia is real means coming to terms with the inevitable changes and the decline in the person's functioning that will happen over time. And this can certainly cause a great deal of fear and anxiety for that family member. So it's also important to acknowledge that family denial can carry with it some substantial risks that are listed here. So, if we aren't open to accepting that these changes are happening, there could be some risks involved with that. So the first one here is an accident and or illness. So without appropriate intervention and support, there is a risk that the person with dementia will have an accident. So Chris mentioned some of these earlier, but leaving a tea towel on a hot stove could cause a fire. Forgetting the rules of the road and getting in a car accident, or losing one's way and becoming lost. So, if we aren't acknowledging some of these changes and getting the help and making adaptations where needed, some of these risks are possible. Brain changes in reasoning, decision-making, and memory may mean that the person with dementia also does not seek help for a medical problem that needs attention. So for example, maybe they had a fall and they fractured a bone, or twisted their ankle, or have an immense amount of maybe swelling, but because of that lack of awareness that we talked about earlier, they're not making that connection of, oh, this is something that needs medical attention and I need to go to the doctor now. So a family member may show up and be like, oh my goodness, what's happened? You need to go to the hospital, and they don't seem too concerned about it. The second one here is family conflict. So when some family members accept a diagnosis and others deny it, inevitably disagreements and conflicts can arise. And this may heighten the tension and stress between the members of the family. And the person living with dementia may certainly sense that as well. Lack of medical intervention and treatment is another risk. So while medications for dementia are not a cure, when taken early, they may slow the progression. So the key to successful treatment really lies in that early intervention. So essentially, the earlier, the better. So denying the diagnosis means that the person with dementia may not be able to start the treatments or medications in a timely manner. So denying the diagnosis can also mean delaying the diagnosis, and that can certainly be a risk as well. Financial exploitation. So we're all at risk at falling victim to scammers. However, a person living with dementia may be more prone to falling victim to fraud because their reasoning abilities can deteriorate over time. So their ability to make a kind of reasonable decisions and decisions that are in line with their character. So they may start to make kind of more risky decisions that are kind of out of character for them. And here there's also the potential for close family members and friends to take advantage of the person living with dementia as well. So, we need to make sure that the person is, well supported in this area. And stress for the primary care partner can also be a concern here. So caring for a person with dementia can certainly be challenging, and the more people, whether that's family, friends, neighbors, or community organizations that can assist the person with dementia, the better. So the bigger we can make that support team, the better. By denying a diagnosis, more pressure is really put on the person with dementia and their primary care partner that can really lead to stress and burnout. So if we have, some of those family members that are maybe denying that diagnosis and don't see the need to help or the need to support the person and the primary care partner, that can really add to the amount that they're taking on. So let's take a closer look now at how you can help a family member experiencing denial and some things that we could possibly do about that. So first, a family meeting may be helpful. So here we want to really set the scene, pick a time when no one's in a rush, and make a pot of coffee or tea, put away distractions like cell phones, and ensure that you won't be interrupted. So really having that time laid out, set aside for undivided attention and conversation is key. Second, give space for everyone to express their concerns and fears. So acknowledge these concerns without judgment, even if you do not agree with what the other person's saying. You might say something like, I can understand where you're coming from. That behavior would concern me too. But giving everyone that space and that time to share their perspective can be really important for enhancing kind of the overall understanding of it, how everyone's seeing the situation. Third, we can also consider explaining the implications of denial. So you may want to mention some of the risks that we just mentioned, and some of the things that maybe that person hasn't considered, like the accidents or exploitation or added stress that we talked about. And then lastly, provide support where you can. So you might offer to get groceries, help with yard work, or take the person with dementia out for a drive so that the primary caregiver has some time to relax. Let the care partner know about the education and services provided by the Alzheimer's Society, free of charge, and you can self-refer, you do not need a doctor's referral for our services. Because helping that person to better understand dementia will also be helpful because, there's so much stigma around dementia that often the person can get in denial, maybe, believing some of those stigmas, and that might be holding them back as well. And also know your limits. So if the care partner is still in denial, perhaps a professional counselor might be an option to consider. And, if they won't go, you can go to discuss and work through your emotions, if you feel that would be helpful as a way to support you as one of the primary care partners. So sometimes as care partners, we can get caught up in kind of our own feelings and experiences and forget about the feelings and experiences of the person living with dementia. So let's take a look at some insights from people living with dementia as we conclude our presentation today. So as we mentioned earlier, level of awareness with dementia can really vary. Some people are very aware of their diagnosis, and then with progression, anosognosia, others may not have that awareness. One of the benefits of that high level of awareness, especially when someone has an early diagnosis, is they can share, they can advocate for people living with dementia about their experiences and what would be helpful to them. So these are some of the things that people living with dementia have shared. And they may be helpful to keep in mind, even if we are supporting someone with anosognosia, because if they had maybe a higher level of insight, they may very well share a lot of these things with you as well. So let's take a look at some of them. So here we see on the left-hand side, acknowledge my disease and don't pretend that nothing is wrong. So people living with dementia have said, please don't minimize my condition with comments like, you don't look like you have dementia, or, we all forget things. It's important to recognize that symptoms can appear and disappear at random and may not be evident at times, when we have interacted. So going back even to that whole idea of someone who doesn't visit regularly thinking that nothing is wrong, that might not necessarily be the case. I still need my friends and family. So, many people living with dementia say that it's very important to maintain that connection with friends and family and to maintain normal relationships with people in their life. There's often a fear when people are diagnosed with a dementia of sharing that diagnosis because of the impact that it may have on their relationships with others. Don't treat me like a child. So one of the strategies we often say with communication with dementia is, to speak slower so that, a person living with dementia can take in that information and process that information. But we do have to be careful that we don't, speak slower in, say, like the kindergarten voice that sometimes can happen. And we want to make sure that we're still respecting that person with dementia as the adult that they are. Another insight from people living with dementia is to learn about this disease. So not only does learning about the disease help reduce stigma, but it can help us as care partners to learn how to better support the person living with dementia, and in time, help them to live as well as they can with dementia and reduce stress as much as we can for them as well. We have some more here. So take time to listen. So we often say, practice the pause, or if you're in conversation with a person living with dementia, sometimes it can take up to 30 seconds for the person to process that information that you're saying, listen to it, process it, and come up with a response. So, really giving that time and taking that time to listen to the person and give them that time to respond is really important. Don't stare at me strangely. So people living with dementia, may notice and can notice, when they are being treated differently, whether it's through the look that they receive from someone or in the manner that people react to them after they learn about their diagnosis. So we want to make sure that we are still including the person with dementia and that we don't ignore them. So, talking about them when they're in the room and those types of things. We still want to be very inclusive. Chris touched on this earlier, but let me continue to do the things that I can still do. So with a disease that comes with so much loss and talking about so much loss and seeing those changes, we still want to also focus on the remaining strengths that the person has as well. Give me some space. So, we talked about the importance of routine and structure, but sometimes we need to also work in just some downtime for the person living with dementia. And people living with dementia have shared, there will be times when I need to have a quiet day without a lot of activity or conversation, or I may turn down maybe going to a social setting with a lot of people because it's just too much. So again, the brain needs a break sometimes as well, and they've shared that. Give me time to do things. So again, this kind of goes in line with practicing the pause, but people living with dementia have shared that they need more time to complete tasks, and the things that they're doing. And the moment that they feel rushed, or the moment that they sense impatience from someone else, that can bring about a feeling of stress for them. And they share that when they feel stressed, all of those symptoms can kind of be increased. So memory loss, words not coming as quickly, things like that. And lastly, remember me. So here we want to keep that person and personhood at the center of everything still. So recognize the person with dementia and not emphasizing the disease over the person. So hopefully some of those insights are helpful. Living with and supporting someone with dementia, as we've said, we recognize that it's not easy and can come with many challenges and problem solving. So we want you to know that you are not alone and that the Alzheimer's Society is here to help. So we have a range of supportive services designed to assist you in your journey. So you may already be a client with us and have a client support coordinator and be very well supported. If this is your first time connecting with us through our virtual education, we encourage you to connect with our intake coordinator, Maddie. She's the first point of contact for anyone who either is referred through a doctor or self-refers to our society, and she can connect you with the right person and the right programs to help you meet your needs and to better support you. And we also want to take a moment to thank our donors and share that we do rely on the generosity of donors to bring our programs and services to life. So many people ask us kind of how our funding works. So a portion of our funding is provided through grants and financial support from the Ministry of Health, but donors help us to deliver the care and support that's so desperately needed for people living with dementia and their care partners, especially as that demand increases. So we want to thank you to all of our donors and for their continued support. And thank you for coming today as well. So we're going to, at this time, we'll stop the recording and we'll stop sharing the screen and we can address any questions that you have.